Understanding biological sex, busting myths around biological sex, and exploring sex variations with the Rosie Project. First up, let's talk about sex. No, not the sex that you do, but the concept of sex that you are. When people refer to biological sex, they usually mean male or female, aka whether you're born with a penis or a vagina, and whether you have XY chromosomes or XX chromosomes. This may seem very obvious and a basic idea, but actually this is a very oversimplified view of biological sex. How is that possible, you might ask? Well, what many people don't realize is that there is not just a male and female binary, but in fact a spectrum of sex. For example, stereotypically, we think of females as having XX chromosomes, a vagina, a clitoris, and a uterus. And we think of males stereotypically as having XY chromosomes, a penis, and testicles. But actually, sometimes there are people born somewhere in between the two, where they can have a different combination or variation of physical, hormonal, and genetic features. So that means a different makeup of chromosomes and differently appearing genitals. People with this biological sex variation are called intersex. These variations in sex can be obvious or very subtle, some noticeable at birth and some only noticeable later on in puberty. There are even more variations with sex when we look at chromosomes. Some women may be born with a vagina, a clitoris, and a uterus, but have XY chromosomes. Or men may have a penis, but XX chromosomes. Planned Parenthood estimates that 1 to 2 in every 100 people in the US are intersex. So, it's very normal and common that these variations occur. Like nature, we have lots of variance in our biological makeup. However, human beings have traditionally always struggled with difference. Intersex and intersex variations are not medical problems or health problems. They're perfectly normal biological differences. However, doctors will often assign an intersex baby into either male or female binaries at birth, and even in some cases, this can involve childhood surgeries. Many intersex people feel like this erases their identity. Science historian Alice Dreger discusses in her book that changing biological characteristics at birth is seen in the Victorian era, when we started to also see very rigid ideas of gender roles. That means what men should do and what women should do. Alice Dreger suggests that the practice of erasing and changing biological difference and diversity started from there, and that's why we talk and think about biological sex in such a rigid and binary way. That meaning that you think that there's only male or female, rather than realizing that sometimes you can be somewhere in between. So, remember, people and people's biological bodies, just like nature, are diverse and complex. It is impossible that with so many variations in our biologies that we don't even really understand, that we could all fit into 2 categories, male or female. We are all different, and most of all, we all deserve to be respected.